we found that the government had 5 reports it kept quoting. 2 from the National Audit Office, which is like your Auditor General office, 1 from the Treasury itself, and 2 from their favourite management consultants. Now, when we looked at the Treasury's own report, we put in a Freedom of Information request. And we kept putting in the Freedom of Information request. And then in the end, the Treasury had to put their hands up and say they didn't have any data. They hadn't actually done the research that they were citing. So then we went to the equivalent of the Auditor General, the National Audit Office, and we looked at their reports, but they were just interviews with managers who were doing the P3 projects. So you couldn't say that all these public projects weren't coming in on time and on budget. And the National Audit Office in the end said, we put our hands up, we don't have the data. But we were using 2 management consultant reports. But when we looked at the management consultant reports, we also found that they had completely fabricated the figures. There were no meaningful data. Now, we've published these as academic studies, and you can find them. So the only bit of evidence that the UK government has that these schemes are value for money and they've transferred risk is the cost and time overrun data. But the figures that they're quoting are made up. And yet, your Canadian governments and the media keep rehearsing these figures. And I think the other thing to remember is that you will have seen that the Comptroller General, or the Auditor General of the National Audit Office, Sir John Bourne, has recently had to resign his post because of enjoying too much of the high life with the P3 sector. But what nobody told you was that actually he was going to P3 dinners with these management consultants and the private sector, advocating the virtues of P3s, and his department have been selling the policy abroad. They've been going and doing training. So the UK Department of Trade and Industry, the Foreign Office, its management consultants have a very strong presence here in British Columbia. And I don't know if any of them are here in this room tonight. But they have helped to design the P3 policy. Now, the P3 policy is a very technical policy, but because it means absolutely overturning all the traditional systems of public administration. It means rewriting the accounting regime, the finance guidelines. The whole of the public system has to be rewritten. And who better to do that than the management consultants and the UK government? And that's what's been happening. If you look at all the Treasury documents that are coming out from the Canadian government at federal and BC level, you will see that they are mirror images of the documents that we have been writing for the last 10 or 15 years in the UK. So the only value for money data is fraudulent. So what about the rewards? Well, one of the problems is that the contracts, when you ask for them, are deemed commercial and in confidence. So you put in your Freedom of Information requests, and when you get the contracts, they're about that deep. And when you look for all the really interesting stuff, like how much the shareholders are getting, it's all what's called redacted, deleted, so you don't get the data. However, we managed to get 6 contracts, although there are now something like 600 schemes which are signed, and we found that the returns to the shareholders would take your breath away. In one of the hospitals near me, the shareholder put in 200 Canadian dollars and will be making 89 million Canadian dollars. Now, this is in a very poor, deprived area, And of course, this is coming year after, these dividends will be paid every year for the next 30 years. But the shareholders aren't waiting until the end of the contract to take down their returns, because within 3 or 4 years of these hospitals or schools opening, the contracts are being refinanced. So the shareholders are moving in and taking their dividends early. Meanwhile, you and your children and your grandchildren will be continuing to service these debts when these schools and hospitals could have been built by public money. And my goodness, you've already, what did you have? $4.4 billion surplus last year. And then Alberta, which is tiny, had an $8 billion, and you had a total $14 billion surplus last year. All of these public schemes could have been built through public money and not through long-term debt. And that's what the legacy that you will be leaving yourselves and your grandchildren. So the rewards are absolutely enormous, and we have now the first 6 contracts that the government didn't want us to have, but one was put into the public domain by the Freedom of Information Commissioner in Scotland, who got exasperated by the public authorities' refusal to say why these shouldn't be in the public interest. Now, I think the situation in BC is even worse than we did, because when we first got the full business cases, which are drawn up before the contracts are signed, we were able to show the scale of the downsizing and the problem. So one of the things you must all begin to agitate for is to get the information and have that put in the public domain and start to take the legal challenges forward if you don't get it. So there is really a lot of evidence from the 6 contracts of the very rich rewards to the shareholders and the venture capitalists. There's not much evidence of the rewards to the public or to patients or to the healthcare system. There's certainly no evidence of efficiency or innovation.
$15 million in additional benefits in the $95 million outpatient hospital in Vancouver. $10 million in additional benefits in the Britannia Mine water treatment plant. $25 million in additional benefits in the new William R. Bennett Bridge in Kelowna.
And I think it's worth remembering that the public sector is now the tenant. So what happens is if you want to put up, bring in a new piece of equipment, or to change anything, or to pin something to the wall, you cannot do it. You can't put a notice board on the wall. You have to go to the private sector consortium who say whether you can do it or not. And if you want to make a single change to your building, as we heard with Wayne, you simply cannot do it. You will have to enter into a commercial contract and renegotiate the whole thing. And we have some evidence of the enormous penalty payments that are accruing. So I'll give you an example. You know when you are in hospital and you have a locker with the water jugs? The private sector, the government had forgotten to put that into the contract, so it had to go back and renegotiate that contract at an enormous cost, simply to allow the privately hired cleaners and ancillary staff to top up the water jugs. So you lose control, and this is all about public control and public accountability. Now, if you're interested in transparency and accountability, you want to see these contracts, you want to see the financial models, you want to see the business plans, and you want to have control so that when you get your epidemics or when you get whatever crisis hits you, the government can step in and say, you do that, we need this, or whatever. But you will have lost control. And the other thing to remember is that if the private sector doesn't like it, it can walk off, but the banks and the shareholders will still have to be paid. So this is a bonanza, this P3, and we're seeing it's a very, very ugly situation. And we're seeing the entry now into the bits of the services that were always deemed sacrosanct. Education, health, justice. All of this now is being opened up, and we're seeing a real feast taking place. So this is the Edinburgh Royal Infirmary where I work, where it should have been £195 million, the total cost, instead of which the government will be paying, the hospital will be paying £1.3 billion at a cost every year of 42 million. And the projected dividends in Edinburgh Royal Infirmary are £190 million, i.e. what it would have cost to build the hospital from public money, instead of which it's paying 6 times as much. You all need to be really vigilant about P3s. It's a totally discredited policy. Even every layer of the press now discounts it in the UK. And indeed, the UK government is rolling back on its own P3 policy just as it's beginning to promote and push it really hard abroad. And Canada is a very important location for our lawyers, our accountants, our management consultants, and our financial services industry. But at the end of this, none of this is in the public interest. It's unevaluated, and it will have catastrophic public healthcare consequences. So it's really marvelous to see you all in this room tonight, and I hope some of you will have it in you to go out and mobilize and do much more around public information and debate and campaigning. And the most important thing you can do is get your own information and your own data and start to analyze the P3s and their consequences. Because once these P3 companies have got their foot in the door around the infrastructure, they will then go in for clinical services. And that's exactly what's happened in the English NHS, where the whole lot is being dismantled and broken up. So the infrastructure is only the foot in the door, and meanwhile you've got the private clinics going on, the diagnostic clinics, the private treatment centres, and over time they will be developing consortium between the P3s and the private clinics, and you will see this happening. Anyway, I'm going to stop here now because I know you will all have lots of questions for everybody, and say thank you very much.